Yes, my name is Alec Giles. I'm a physician associate and I work at St Paul's Way Medical Centre in Tower Hamlets. As a physician associate, we're trained in general medicine. So we train for 2 years as part of a master's programme, 50% lectures and 50% placements. Of that, a lot of the time is spent working in a GP surgery. I train in Tower Hamlets and now I work in Tower Hamlets. So that's been really useful for me actually along the way. Here in the GP surgery, I work as part of the multidisciplinary team. I work alongside GPs to provide medical care for the patients. A day in the life of a PA in a GP surgery consists of telephone triage. I would see face-to-face patients to examine, diagnose and to treat them. Managing long-term conditions and people with complex needs. Calling back patients that have done online consultations. Sorting incoming documents and posts. And we also have a daily supervision session as well.
So my name is Dr Joe Hall. I'm a GP at Bonnier Row Health Centre and St Paul's Way Medical Centre, and I'm a GP in Network 6 PCN. So we're a part of the scheme run by Barts in helping train PAs, and then we've recruited 2 PAs to work in the surgery. So we have over 1,000 appointments a week in the surgery where patients are wanting to see a GP. Not all those appointments have to be seen by a GP, and therefore having a really good skill mix in the team really helps us manage that demand. We find the PAs extremely helpful in managing our workload in a number of different areas.
So the best part of my role is providing the continuity of care for patients actually. So as a PA we don't rotate around like junior doctors, so once we're in the GP surgery, we're in the GP surgery. And actually just kind of building that relationship with patients, just as the GPs would, has actually probably been the best part of my role.
Alec and Mariam, our other PA, see about 100 patients a week at least, but they also do home visits, they also obviously check their blood results, they also do a lot of admin in the practice with the documents coming through. And it really helps us manage that demand, and it helps the GPs really hone their skill set about the kind of complex patients they're managing. The skill mix in general practice is really important, and I think physician associates, nurse practitioners, healthcare assistants are all really important to help us manage the demand within primary care.
As a PA, there's a huge scope for progression of the role. There are a lot of PAs in leadership roles, and actually I know there are a lot of roles in development now where just like a GP with special interest, there may be like a PA with special interest in a certain or particular kind of area that would almost become their specialty.
The roles for physician associates are probably as wide or as complex as you want to make them and create them. So I think it's really important if we can back those physician associates in our practices. There's a huge amount of work they could be leading on. There's a huge amount of work they could be doing for the practice that may help us manage complex patients, maybe improving the care to housebound patients, but also just as a general support to the general workload within the practice is really helpful. Like any new role, you need to invest in it. So we did invest some time and effort in the training programme over 2 years. And then obviously when we're setting up the new physician associates in the practice, we invested time in supporting them. And we continue to provide mentoring, support, supervision to make sure that they're happy in their roles and they're developing according to how we want them to develop in the practice, but also developing their role for themselves. If you're a PCN looking at trying to create really good diverse skill mix within your practice, I would think seriously about having a physician's associate. They can do a number of roles in the practice which will really benefit you. Then it frees you up to work at the skill set that you are trained for as a GP, and it really helps you develop your role as well within the practice.